My name is Ted. I retired after 32 years in family practice, and about 6 years ago I developed a cancer in my stomach. I didn't realize at the time how sick I really was. About 2 days after they told me that this was probably a pancreatic cancer, Dr. Sasan called me and he said, "I've been looking at this, and this doesn't look like a solid type of a tumor, which most pancreatic cancers are. It looks more cystic. We're not sure what it is, but I think I can get it out." So I said, "Well, that sounds good to me." That was on a Wednesday, and Friday I was in the operating room. And he did a rather complicated procedure that took quite a while. Keeping busy is very, very important. And I always told my patients, if you get the diagnosis of cancer, there are a number of things that you need to remember. First of all, you are going to feel at first like a ton of bricks hit you. But in this day and age, I think it's a good idea to try as much as you can to dispel the element of fear, because there's so much that they can do for so many cancers. When I was in medical school, there were a good many tumors, all kinds, that were considered death sentences. Leukemias, Hodgkin's disease, most lung cancers, most colon cancers. You did what you could, but the rest of it was palliative care. That's no longer true. And it's much easier now not only to encourage other people, but it's easier to be encouraged myself, because I know, I've seen firsthand what can be done. There are uncertainties. You talk with your family about it, and of course the first question they ask is, well, how long you got? Well, I don't know. That's not really up to me. And you worry a little bit, well, what's my family going to do if something happens to me? Or how long am I going to be around? Am I going to be able to see my grandkids grow up? This kind of thing. But you learn to roll with the punches quite a little bit. I would admit that it's easier for some people to do than for others. First of all, do not be afraid to talk about it. Number two, do not be concerned that you have uncertainties about things, because you will. Number three, try not to be afraid. And number four, be sure that you have the best help available for you. They're not always easy. I think the biggest thing that I would advise somebody is don't be afraid to talk about it. Don't be afraid to talk about it.
With your family, with your doctor?
Anybody. With your friends, if you're in a support group, with your family, with your physician. And you need to be frank with your physician. You need to ask him or her point blank, okay, how am I doing? What's going on? If things are progressing well, what do I do to keep them progressing well? If things are taking a little bit of a turn for the worst, what do we do now? It never hurts when you receive the diagnosis of cancer, or for that matter, any disease process that eventually could take your life, to get affairs in order, to do things that you know you want to do, to make a list, to be a little introspective, to look inside and say, okay, what do I really want with the time that I've got left? One of the things we hope to do this fall, well, I'll rephrase that, we're going to do this fall, is go to England. I've never been there, and it's a place that I really want to see. We took a trip through the Canadian Rockies not too long ago. Had never done that. It was magnificent. I'd never been to Hawaii, so we decided that we would do that. And these are all things that I'm very, very glad that we did. Not to say I might not go back there sometime, but at least, you know, I've been there, I've seen them, and I don't think it hurts to think in terms like that, so long as you don't dwell on them so much that you don't get anything done. Don't be afraid to talk about it, but don't be afraid to listen. Listen to other people. Listen to other people's experience. Listen to what your doctor has to say. Because with the more knowledge you have of something like this, generally the less fear there is. The fear of the unknown is a pretty big fear. There are so many resources now that you can call on for that. Get your family involved. Don't hide things from them. If they have concerns, you need to talk about it. You need to talk about it. I've been very lucky in that regard.